Hello, everybody, and welcome to the Mental Health Minute by Elite DNA. I'm Phil Cirrone, the Chief Operating Officer, with my colleague, Dr. Sharon Bloom, the Chief Clinical Officer. How are you, Dr. Bloom?
Hi, good morning, Phil.
Good morning.
Today's show is about one of our newer services at Elite DNA. Just celebrated its 2-year anniversary, and that is case management.
So with us today to talk about case management is the supervisor of the case management department, and also an individual who is currently in the Master's of Social Work program at Fordham and plans on becoming a licensed therapist here in the near future. Misty Bruekener. How are you, Misty?
Good. Thank you for having me.
So Misty, can you tell us what exactly is case management?
So case management, that's a big question, Dr. Bloom. Case management is a community-based service. We are currently seeing both children and adults for targeted case management, and those individuals have Medicaid insurance. All of our case managers actually have to go through a certification process, and so everybody is certified through the Florida Certification Board. So technically, they're certified as behavioral health case managers. So the population of individuals we really are working with are individuals who have a diagnosis of a mental health condition. A large part of the case management program is really assessing an individual or family's, get a holistic understanding of what their needs are. As a case manager, we complete what's called a strengths-based assessment. So we really want to try to foster this non-judgmental, supportive environment where we can really get an idea of what's going on with a family. So we focus on their strengths and the things that they feel they're doing well. And then we also kind of look at the things that they feel maybe that aren't going so well, and things that they maybe want some assistance with. And then we also kind of explore with them, what does it mean when things are better or look better? Because this really truly is a collaboration with individuals. Case managers don't do things for individuals, but we work together as a team to make sure that we're meeting their goals and their objectives. As a case manager, we gather a lot of different information in regards to a lot of different areas. Like I said, we're trying to get a holistic picture of what's going on with an individual. So we're talking about their mental health. We're exploring what their physical health needs are, safety, maybe there's safety concerns in the home, finances, maybe helping create a budget, vocational needs. Sometimes individuals would like help with getting a job. School and education needs, especially with our kids that we work with. A lot of our, part of our role is to advocate for them within the school district. We attend IEP meetings, school meetings, we gather information, because a lot of what we're trying to do is give the providers a holistic picture of the individual. So what are their grades like? What's their attendance like? Are they having behavior issues in school? We're also looking at them, their spirituality and their culture and how that's affecting their treatment. Family relationships, who's all living in the home? How are they getting along? Any legal concerns? Sometimes we get individuals who maybe have some legal concerns. Maybe they're on probation. Maybe they're looking to apply for disability. Maybe there's DCF involvement. Whatever that looks like, we kind of help them through those systems to try to make it a little bit of a easier process for them. Housing is something that we also can assist with, although the housing in Lee County is a difficult process, so I'll throw that out there. And then also socialization. So that's a huge piece right now, especially with the COVID situation going on. So basically, like I said, we work together as a team with our families. A lot of our work is collaboration. So case managers, we definitely have been seeing our clients probably like every 2 weeks right now during the COVID situation. And basically just trying to, bridge the gap and, most of the people are not coming into the office right now because of the situation. And so a lot of our families are isolated. So just being there to be an extra support person. Let's see here. So also, sometimes people have a lot of health issues going on. So we're able to collaborate with those providers, advocate for those providers. Sometimes people will get a referral to a specialist and they haven't heard back. And so being able to help follow up with some of those things, and the insurance, like who is accepting, what insurances for doctors or dentists or things like that, that we need to help connect them to. And like I said, we just do a lot of advocating for our individuals that we work with, like I said, within the school district, linking to community resources. Sometimes, that isn't an easy process because there's a lot of different qualifications for the different processes that are out there. And so we help make them, a list of all the things that they need to gather so they can, be somebody who can apply for those different programs that are out there.
Misty, I'm sorry, can I ask you, you raised a really good point and it makes me think. So you mentioned a lot of your services are community-based, right? So what is your team doing during COVID to be able to deliver those services?
So during the COVID situation, you're right. Most of our services are usually done in the home or in the community, which is like the schools, different agencies, and that sort of thing. All of our services right now are moved to the telehealth through the Zoom platform. Now, we do have some families that they don't have access to Zoom, so we've been flexible in being able to meet with them over the phone and kind of just meeting them where they're at and what they need right now, because some of our clients have put therapy services on hold right now because maybe they're not comfortable with the Zoom platform. And so we've definitely been able to stay into contact with them and offer them alternatives to be able to advocate for them to maybe have a session over the phone, or at least maybe keep in contact with their therapist once a month or something like that during this time. So a lot of it, and a lot of our families are isolated, and quite honestly, we, as a parent, a lot of people have been thrown into this dual role of we're a parent and now we're a teacher. And a lot of especially the kids that we work with, there's reasons why we're working with them. They're having issues in school. And so whether that behaviorally or they have individual education plans. So that's been a lot of added stress for a lot of the parents and caregivers that we've been working with. So being able to still collaborate and reach out to the schools, and especially like with the technology piece, some of our families are not very good with technology. And so being able to advocate for them with the individual's teachers and making sure that there's communication going on. So, their school isn't as disrupted as, it would be. So that's a lot of what we're doing during the COVID situation. To kind of help our families. We're just thinking outside the box and, really just trying to support our patients the best that we can, and they're excited, when they meet with us by Zoom, especially some of the kids, and sometimes like I've sent some coloring sheets, in the mail to some of my clients, and then they can color them and show me the next time that we meet by Zoom. So just trying to be interactive and let them know, like, hey, I'm still thinking about you, even though I'm not coming to the house or to your school anymore right now to see you. So,
sure.
It's an amazing, amazing service, Misty. Tell me, you have a unique perspective as you're studying to become a therapist. How does the role of the case manager differ from the role of a therapist?
So I like to think, so therapy really, it's similar as a social worker doing therapy in the fact that we want a holistic, view of what's sort of going on with an individual. Excuse me. Because we know, right, a person's mental health can be influenced, not only by their biology, but also their family history, their environment, and other social factors that might be going on. But for therapy, we're really focusing more on the mental health symptoms of a person or an individual, and how can we, help them with the symptoms, with coping skills, with some of the symptoms and behaviors that they're experiencing. As a therapist, we also are able to process through trauma, previous trauma, work with parents on, parenting issues, or basically expanding and enhancing their parent abilities, And then basically helping people understand their interpersonal relationships. Therapists also work on things such as mindfulness, reframing their negative thinking. So it's much more of a clinical role versus the case manager who really tries to wrap around the family, increase their natural supports, because the whole idea is that we're not going to be there forever, right? So, being able to help them and model for them, how to advocate for themselves, how to access these resources in the community. And, that's the goal, is for us not to be involved forever.
I think they really go hand in hand, don't they? I know I've enjoyed a lot of shared cases with you, and as a therapist, you see work with the client a certain prescribed amount of time per week or every other week, but you don't know what happens outside of that visit. And the case manager can really delve into their natural habitat and see what they're up to and help link them to these resources and really collaborate. So I think it provides that just comprehensive care. It's really a wonderful addition to the Elite DNA team. And the team is growing.
We are growing. We just are hiring another person who's starting on Monday. So there's going to be five of us now, I think. So, and the other unique thing about the case management program is when individuals are working with a case manager, it's different in that when they're seeing a medication provider or they're seeing a therapist, they have like scheduled dates and times that they see them. Yes, we have scheduled dates and times, but individuals are also able to contact us during regular business hours, like if something comes up, or maybe they got something in the mail that they didn't quite understand, or they need assistance or just an extra support person to talk to in between time.
Well, just like all the other speakers we have, I always like to mention that anybody who's interested in getting started on services and feels like potentially they could be a good fit or could benefit from case management services, that is a service we offer in-house for our patients if they meet the criteria that is dictated by the Medicaid. And so elitedna.us is our website. Anybody can go on there and get more information on our services. They can also get a virtual intake by going to our waiting room in there. BC Now, I think is what it's called. And so, Misty, I appreciate you coming on and shedding light to not only what your team is doing now during COVID, but ultimately how case management can help a patient overall, especially in regards to the treatment plan and the team collaboration. So thank you so much for joining us. As always, Dr. Bloom, thank you for joining me, and I look forward to our next Mental Health Minute. Have a great day, everybody.
Thank you.
Thank you.
Oh, there